This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
Hey guys, Dr. Lynch here. I want to do a medical minute today, a little bit different, but I think it's pretty relevant and pretty important. So just the other day I was flying, and a little bit about me, I really don't love flying. Sitting in the airport, a little bit of time to kill, and I did what I think is probably the equivalent of looking up my symptoms on WebMD, and I started looking at airline accidents over the years, and I ended up going down this rabbit hole of airplane safety. And I came across a story that I kind of vaguely knew about, but wanted to share with everyone. So it takes place in 1977, and this is a tragic collision of two Boeing 747 airplanes on the runway at Tenerife Airport in the Canary Islands. This still to this day remains one of the most deadly aviation disasters of all time. And it was kind of the perfect Swiss cheese model. So what happened was there was this KLM flight that was attempting to take off without proper clearance. And it was a kind of foggy day. They thought they had clearance for takeoff, but the communication between the pilot and the tower was really not thorough enough. And they ended up, trying to take off, and they collided with this Pan Am flight that was taxiing on the same runway and ended up killing about 583 people between the two planes. Really, the key contributing factor to the accident was a breakdown in communication. And so the pilot of the KLM airline was one of the most senior pilots that they had. And he was really eager to depart due to scheduling pressures. And like I said, there's poor foggy weather conditions. And there was a co-pilot in there who was a flight engineer. And he had noticed some inconsistencies, noticed that there was a lack of communication with the air traffic control. And then he failed to assertively challenge the captain's actions. And because the captain was the most senior captain in the whole KLM company, he was never questioned. And really, this crash underscored the critical importance of effective communication, and really the need to empower individuals, voice their concerns, really regardless of any hierarchy. So, kind of bringing this back here, this really got me to thinking about communication in medicine and how there really is a profound lesson to take away from this, particularly for nurses, paramedics, techs, all working with physicians in the ER. In both aviation and healthcare, obviously this is a very high stakes environment, and that often individuals, there's varying levels of authority and expertise that are all working together as a team. And, like the co-pilot in this crash, as nurses, you may notice potential risks or errors in patient care. And, you may feel hesitant to challenge or question a physician's decisions due to some, perceived power imbalances, fear of retaliation, lack of confidence, feeling new. But really, the safety of patients depends on really fostering a culture where everyone truly feels empowered to speak up. More often than not, nurses are the closest to the patients. You observe subtle changes, and you see these kind of potential warning signs. And if these concerns are not raised and addressed promptly, these can lead to pretty severe harm or even death. And, and I think we already all do this. And, obviously this isn't a groundbreaking medical minute here, but, I think it's a nice reminder that it doesn't really matter if it's your first day in the ER, you've been a nurse here for 10 days, if it's a new doctor at a residency, a senior partner, a trauma surgeon, everyone should feel empowered to speak up if something doesn't seem right. One more thing that kind of comes to mind when kind of going down this was, particularly mistakes that get made at the end of shifts. I know myself, I'm less sharp after, 6 or 8 hours of a busy shift. And there's a ton of evidence to support this. There's study after study that examine medical errors that occurred during the beginning versus the end of a shift. I reference a couple of them here because I think they're just so interesting. So these guys, Hana et al., they did a retrospective study looking at 2.9 million radiologic examinations and found that the interpretive errors were significantly more likely to occur later in shift, peaking around the 10 to 12 hour mark. Suggesting that longer shifts, higher diagnostic volumes are associated with increased error rates. These other guys, Levitan, they looked at prescription errors and found that physicians were definitely more likely to make errors during their second and third successive shifts compared to their first shifts. These guys, Hennedy, they looked at medication ordering errors, higher for physicians on overnight and post-call shifts compared to those who were off call. These guys, Gotts at all. They looked at surgical procedural complication rates higher during the last 4 hours of a 12-hour shift compared to the first 8 hours, really indicating that fatigue and shift length impact procedural competency. So the overall takeaway is that really the stakes they're just too high to remain silent. And the only way we will succeed for our patients is if we have truly open lines of communication between everyone, regardless of your training level, regardless of your time working here, regardless of any letters after your name. And it really is imperative to look out for each other, especially near the ends of our shifts when we're a little bit less sharp, because that is when we are definitely most prone to errors. That's all. Let's have a good day. Thanks, fans. Bye.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.